Hello juniors, so I welcome you all again in the continued series of upper limb and thorax, and today we are going to cover an important topic, that is thoracic duct. So in today's module we'll be covering its introduction, course, relation and tributaries of thoracic duct. So without wasting further any time, let's move ahead. Thoracic duct. First, starting with introduction. What is thoracic duct? It is the largest lymphatic vessel. So this is the diagram taken from Vishram Singh Anatomy. You can appreciate this green color duct. This green color beaded appearance duct is our thoracic duct. So it is the largest lymphatic vessel, accounts for draining major lymphatic vessels of the body. So thoracic duct accounts for draining major lymphatic vessels of the body. Now extends from upper part of abdomen to lower part of neck. Extends from upper part of abdomen. So just for giving you an orientation, it extends from upper part of abdomen. We'll be covering this slide in upcoming slides. So this extends from lower part of neck. So here this diagram is just to orient you where the thoracic duct lies. So in extends from lower part of, starting from here, extend from lower part of neck to the upper part of abdomen. So as it is saying, extends from upper part of abdomen to lower part of neck, crossing posterior and superior part of mediastinum. So crossing posterior and superior part of mediastinum. Lastly, 18 inches long, beaded appearance because of presence of valves. As I have showed you this in this diagram, it is a long tube-like structure with beaded appearance. This beaded appearance is because of presence of valves in the thoracic duct. So done with the introduction. Here is the more realistic diagram just to orient you. Starting from here, this thoracic duct starts from here and from the lower neck and extends up to upper abdomen right here. Coming to the next slide. So this is I have a 3D anatomy app. In 3D anatomy app, I have taken out this is the lateral view, and here it shows the thoracic duct. You can appreciate this long green colored thoracic duct which is lying anterior to the vertebrae column. Long green colored duct is a thoracic duct, and an anterior view we have got from here. This is our thoracic duct. Moving further to the course of thoracic duct, we have got course. I'll one by one I'll explain you these points and show them with the help of these diagrams. Course begins as upper end of cisterna chyli near the lower border of 12th thoracic vertebrae. So what here it is trying to say, begins at, this is our cisterna chyli at the 12th thoracic vertebra. This is cisterna chyli. It starts from cisterna chyli from 12th thoracic. This above lumbar one is our 12th thoracic vertebra. So what is cisterna chyli? Cisterna chyli is nothing but a pouch where a sac where the lower lymphatic vessels drain into this pouch, in this sac, which is called cisterna chyli. near the lower border of 12th thoracic vertebra. Then it enters thorax through the aortic opening of diaphragm. So in it enters through the thorax through this opening. This is the aortic opening of diaphragm. This is our diaphragm. So it enters thorax through aortic opening of diaphragm. So it enters the thorax through the opening of diaphragm. Next, it ascends through posterior mediastinum from level of 12th thoracic vertebra. So I'm showing you what is the mediastinum just to orient you. What is mediastinum? Mediastinum is the space in between the two lungs where the heart sits. So this is the portion in blue color is our posterior mediastinum. This is the lateral section of thorax. Now again back to the ascends through the posterior mediastinum from level of 12th to 5th thoracic vertebra. What here it is saying there starting from here, this is our 12th thoracic vertebra to 5th thoracic vertebra. It moves posteriorly, as I have shown you above. In this slide, it is posterior most, so it is going through the posterior mediastinum. This is what it is saying, ascends through posterior mediastinum from level of 12th to 5th thoracic vertebra. Then it crosses from right side to the left side. Crossing from right side to the left side, I have this at 5th thoracic vertebra. It is in right, then it crosses to go in left side. Then it goes through the superior mediastinum along left edge of esophagus and reaches neck. So here this is what it is saying. It goes into superior mediastinum along the border of esophagus and then goes into neck. This is what it is saying. In neck, it curves laterally along at the level of transverse process of 7th cervical vertebra. So what here it is trying to show you is here at the level of neck. Here at the level of neck, it curves at the level of 7th cervical vertebra. It curves laterally along at the level of 7th transverse process at the level of transverse process of 7th cervical vertebra, and then it descends down and open into angle of junction between left subclavian and left internal jugular vein. So this is our left subclavian and this is our left internal jugular vein. So this thoracic duct opens at the junction between left subclavian vein and left internal jugular vein. So by simply remembering this diagram and this diagram wholeheartedly, you can write set course very easily. You won't face any problem once by remembering this whole diagram. So done with the course, done with introduction and course. Now the relations. The relations of thoracic duct. So relation of thoracic duct we will see at the level of aortic opening of diaphragm. This is our at the level of aortic opening of diaphragm. Secondly, in posterior mediastinum, this is second and posterior here in the posterior mediastinum. Thirdly, in superior mediastinum, this is our superior mediastinum, and fourth in the neck. So one by one we will cover relations at these levels. At the aortic opening of diaphragm, this is the same diagram I have taken from previous slide. So this is our aortic opening, this is our aortic opening of diaphragm, and this green color opening is our thoracic duct. So here we have to see the relations of thoracic duct. So anteriorly I have this whole diaphragm, anteriorly I have whole diaphragm, posteriorly as I showed you, this is our vertebral column, this is the bone of vertebral column. In the right side I have azygous vein, and in the left side I have aorta, which is as simple as that, because you can simply see this diagram and say what are the relations of the thoracic duct at the level of aortic opening of diaphragm. So done at the level of aortic opening of diaphragm. Nextly, in the posterior mediastinum. In the posterior mediastinum, I have tried to make you visualize. This is my 3D anatomy software, with the help of which I have taken. This is the transfer section at the level of posterior mediastinum. So I have zoomed it out. So this is our thoracic duct. This green color duct is our thoracic duct. So seeing the in posterior mediastinum anterior to thoracic duct, I have diaphragm, esophagus, and right pleural recess. This is our diaphragm. This is lying anterior to the thoracic duct. What I have again telling you, this I have taken a transfer section at the level of posterior mediastinum and zoomed it out. So relations anterior to the thoracic duct are, this is our esophagus, this is muscle of esophagus, this is our esophagus, this is diaphragm, and I have pleural recess. All leftover space is our pleural recess. So anteriorly I have diaphragm, esophagus, and right pleural recess. Posteriorly I have vertebral column, right posterior intercostal artery, terminal branch of hemiazygous vein. As I have showed you, this is my thoracic duct. This is the vertebral column right here. This is the vertebral column. And this is terminal part of azygous vein, which is lying posterior to the thoracic duct. Terminal part of azygous vein, and posterior intercostal arteries, which is not shown in this diagram, which should make sense to you that arteries are present in between the ribs, which lies posterior to this thoracic duct. Done with the anterior and posterior. To the right I have azygous vein, and to the left I have descending thoracic aorta. To the right I have azygous vein. This when extends down forms the azygous vein. To the left I have aorta. So done with the relations of at two levels. Now in the superior mediastinum, in the same way you will be doing the relations of superior mediastinum. Anteriorly I have aorta, origin of left subclavian artery. Posteriorly I have vertebral column. In right I have esophagus, and in left I have pleura. And then again in neck, relations at the neck can be remembered by viewing this diagram and remembering this diagram. So one by one we will cover the relations. Thoracic duct forms an arch and its relations are anteriorly I have left common carotid artery. So visualizing this with the help of this diagram. So right now here this is my posterior side, and this is anterior. So posteriorly I have vertebral column, and this is my thoracic duct. This is thoracic duct. So anteriorly I have left common carotid artery, left vagus, Anteriorly I have left common carotid artery, left vagus nerve, this is black dot refers to vagus nerve, and left internal jugular vein, left internal jugular vein, this which is present with carotid artery is the left internal jugular vein. So these three structures are lying anterior to thoracic duct. And this should make sense to you because I am just telling by viewing this diagram. This is our carotid artery, internal jugular vein, and vagus nerve, which are lying anterior to the thoracic duct. Posteriorly, I have vertebral artery and vein. This is my vertebral artery and vein. This is sympathetic chain. This is prevertebral fascia. This is phrenic nerves, scalenus anterior muscle. All this forms the posterior relations of thoracic duct at the level of neck. So done with vertebral artery, vein, sympathetic trunk, which is sympathetic chain, thoracocervical trunk and its branches. I think this is not shown in this diagram. I have left phrenic nerve. This is the left phrenic nerve in the black dot. Medial border of scalenus anterior. This is the medial border of scalenus anterior muscle. Prevertebral fascia, this is our prevertebral fascia, green color prevertebral fascia, and first part of left subclavian artery. Left subclavian artery also not shown in this diagram. So you can just visualize this diagram in exam and can easily write the relations of thoracic duct. Done with the introduction, course, relation, and in the last we will be covering its tributaries. So as I've shown you earlier, this diagram for your orientation, these are tributaries. So mainly we have three branches in the left side in the thorax region and three branches in the right side. So one by one covering. First branch is our left jugular lymph trunk. Left jugular lymph trunk, which is formed by the vessels of lymph node draining the neck. So these I have drawn the green color lymph node and their vessels just to orient you from where it is draining. So left jugular lymph trunk is draining from the neck. Then I have left subclavian lymph trunk, which is draining from the lymph nodes from axillary region. And thirdly, I have left bronchomediastinal lymph trunk, which drains lymph node from thorax region. They all three combine at this junction, and at the angle they drain into this thoracic duct in the left hand side. Similarly, the right hand side, I have this. Firstly, I have right jugular lymph trunk. Samely, right jugular lymph trunk has similar work as left jugular lymph trunk. It drains from neck. Similarly, right subclavian lymph trunk drains from axillary lymph nodes, and right bronchomediastinal lymph trunk drains from right thoracic lymph nodes. These all three trunks drain into a common duct, which is right lymphatic duct. Here we do not have the left lymphatic duct, which because these three are directly draining into thoracic duct, but here they are not draining directly into thoracic duct. They are draining via right lymphatic duct. This is our right lymphatic duct. This is our right lymphatic duct, which drains into right bronchocephalic vein. This is our right bronchocephalic vein. So majorly we have all these six 1, 2, 3 in the left region and 1, 2, 3 in the right region. These three all drain into right lymphatic duct. And in the last, just for your knowledge, we in lower body we have external iliac lymph trunk and right and left external and internal iliac lymph trunk, which drains into cisterna chyli, as I told you earlier with what is cisterna chyli. So done with the thoracic duct. Then with introduction, course, relation and tributaries of thoracic duct. So if you found this video helpful, do share and like this video. Thank you.